Now that fourth COVID shots are approved for those 50 and up, those inclined to get it may wonder when. Daniel Hamburg asked an expert. Daniel.
Well, Alicia, the CDC says to wait at least 4 months to get a second mRNA booster, but the infectious disease doctor I talked with says he recommends waiting 6 months.
I think if you're over 50, especially if you're older, above the age of 65, have more medical conditions or immune suppressed, a fourth shot is a very good idea.
That's the recommendation of UPMC infectious disease specialist Dr. John Goldman and that of the CDC after the FDA authorized a second booster shot of Pfizer's and Moderna's vaccines.
I think what we're finding is that the boosters, particularly for older people, particularly for people who are sicker, provide you with protection, particularly against severe disease and hospitalization.
The authorization also allows those moderately and severely immunocompromised to get a fifth dose at least 4 months after the previous one. Goldman says it's a bit of a judgment call whether you should get the second booster.
My parents are older. I would strongly recommend it for them. I'm going to get it because I probably get exposed more than most people working in the hospital.
The CDC also now says adults who received a primary vaccine booster dose of the Johnson & Johnson shot at least 4 months ago may now receive a second booster dose using an mRNA COVID-19 vaccine. For all these recommendations, the CDC says to wait 4 months, but Goldman has a different opinion.
I wouldn't recommend it before 6 months unless you're immune suppressed. The way I'd like to put it is you should walk, not run to get your booster. If you wait if you wait a little bit of time, it's unlikely to hurt, may even conceivably help by giving you longer lasting immunity.
And while we're talking about fourth doses, it's important to note only about half of Americans eligible for a third shot have gotten one. In the studio, Daniel Hamburg, ABC 27 News.